You're watching Good Day Austin on Fox 7.
According to a new study published by the New York Times, women who rely on birth control pills or contraceptive devices that release hormones have a small but significant increase in the risk for breast cancer. Here to discuss the study's findings is oncologist and breast cancer specialist, Dr. Debra Patt. Good morning, Dr. Patt. Thanks for joining us. Let's talk about this study. Can you break it down for me, please?
Sure. So this was a large study from a large observational study from Denmark, looking at almost 2 million women over a period of time, trying to characterize if there is an association between contraception and breast cancer. And specifically, they looked at oral contraceptives, but there were also IUDs. You know, it's an important study because previously we thought with lower dose, newer oral contraceptives that there wasn't an increased risk in breast cancer. And what this study showed is there actually is an increased risk in breast cancer. Patients need to know.
What kind of increase are we looking at?
So it depends on the time you took the oral contraceptives. So if you've taken them for 1 year, the risk goes up by about 9%. If you've taken them for up to 10 years, then it can go up by as much as 38% on average.
That's pretty significant.
It is. I mean, I'll say that overall, the incremental increase in breast cancer is about 1 in around 8,000 because women in that age cohort traditionally don't get a lot of breast cancer anyway, thank goodness. But it is a substantial risk increase. So especially for women that are taking it for a longer period of time or might be at increased risk anyway, it's important they understand it.
And if I am one of those women who has been on a birth control medication for decades now, should I be concerned?
This is what I would recommend, is you should talk to your doctor. I mean, absolutely, this is something that people should be concerned about. It is a risk among other risks of taking any kind of medication. For some women, it's still going to make sense for them to take oral contraceptives for a number of reasons. And so I would recommend they talk to their doctor so they have a clear understanding about risk and benefit. What I think this means is that obstetricians and gynecologists and primary care physicians who are prescribing a lot of these medications are going to have a lot of discussions about this with their patients.
Were you surprised by the findings?
I was. You know, if you look back 30 years ago, the oral contraceptives that the generation of our mothers took, they were about 10 times a higher dose. And so it wasn't surprising that those medications were associated with an increased risk. But with such a low dose, we really didn't think that there was an increased risk. And so previously, we've not characterized that with patients.
So what conversation will you be having with your patients now?
You know, well, so as a breast cancer specialist, obviously I see a lot of patients with breast cancer. You know, for them, because either they're survivors or at high risk, you know, most of them will not be able to take oral contraceptives because it would increase their risk by too much.
Okay, and then a young woman who is thinking about getting on the pill?
I think, again, they need to have informed discussions with their doctor. In truth, the overall magnitude of increased risk is relatively low, and so for some women, it's still going to make sense as the right choice, you know, depending upon why they want to be on oral contraceptives and other information in their medical history.
Bottom line, though, talk to your doctor about it.
Go talk to your doctor.
All right. Dr. Patt, thank you so much for joining us this morning.
Thank you, Amanda.